Public health precautions are in full force in Uganda after more than 100 confirmed Ebola cases and at least 30 deaths.
There is no known treatment for Sudan Ebola virus.
No treatment for this strain and no approved vaccine.
The Ministry of Health will be evaluating the efficacy of 3 candidate Ebola Sudan vaccines on contacts in the coming weeks.
One of those is from U.S. pharmaceutical giant Merck. The company hopes to fill 50,000 doses of an experimental shot for eventual use in Uganda. Officials hope to begin administering shots in the next 2 weeks. But more than a month into this outbreak, cases are now spreading in the country's capital, Kampala.
In short, it's a dire, tragic situation, but one that is also predictable.
Scientists at Canada's National Microbiology Lab helped develop the world's Ebola vaccines, including one for another strain of the virus, which sparked a massive outbreak in Africa nearly a decade ago. The Public Health Agency of Canada told CBC News scientists are continuing research into a vaccine for the Sudan strain, but there is no clinical-grade stock available to provide.
Fundamentally, we need an approach that doesn't rely on market incentives to develop vaccines and other interventions against infectious diseases.
In Uganda, global agencies including Doctors Without Borders, the Red Cross, and the World Health Organization are all mobilizing to provide support in rural communities and in the capital. A Kampala resident told us people are trying to stay safe.
So there's all these precautions that are being put in place, and my hope, my assumption, my belief is that this will not get out of hand.
A hope Ugandan officials are striving to make a reality before this virus spreads any further. Lauren Pelly, CBC News, Toronto.